A very good afternoon to everyone. Today we are going to see about a doctor called as John Snow. My name is Dr. S. Suganathan Soundararajan, Assistant Professor, Community Medicine. Objectives. At end of the session, participants should be able to explain John Snow's contributions, explain cholera outbreak, discuss about water contamination, explain about spot maps, discuss John Snow's role in anesthesiology. John Snow was born on March 15th, 1813, Berkeley, Yorkshire in England. Medical training, University of London, and was an MD graduate in 1844. Apprentice. At early age, he was apprenticed to a surgeon, William Hardcastle. Field of interest. Being an eminent epidemiologist, he had great interest in field of anesthesiology. Special name. His contributions gained him a special name as father of anesthesiology. Cholera outbreak. During John Snow's period, cholera epidemic was a very big epidemic. During 1854, cholera epidemic was encountered in a coal mining village called Killingworth, a town in England. Airborne epidemic. The population was believing that cholera was an airborne epidemic. Oral transmission. Snow worked very smartly and found that cholera entered the body through oral route while taking drinking water. Cholera investigations. He carried out the investigations in the street of Soho, London, and published an essay on mode of communication of cholera in 1849. Water pump. This picture elicits the water pump where John Snow saw the clustering or organisms of bacteria cholerae and the street. Water contamination. Contaminated water. The industrialized city where all the waste contaminants were disposed in the river of Thames. Domestic waste. Majority of homes dumps the raw sewage and disposed in the river of Thames to prevent cesspit overflow. Sanitation movement. John Snow's contributions and his embarking very big, marvelous work led to the sanitation movement, where John Snow work led to sanitation movement and led to developing sewage drainage system. Water purification. Snow's work led to developing water purification system in the ways to supply pure water. Smart map and water pump. Vibrio cholerae. As we know, Vibrio cholerae is a species of gram-negative, facultative, anaerobe and comma-shaped bacteria. Spot map. It was very tough for Dr. John Snow to identify the agent causing cholera, so he used a spot map to trace the bacteria. Hopeful physician. During the John Snow's period, his psychological mind was a very big pathway to his humanity, that individuals should not be viewed as a patient or they should not be isolated because of the cases of cholera. Cases tracing. Water pump. Snow carefully started tracing the cases using a spot map and found and noticed how the agents causing cholera centered the water pump. Spot map. The handle of water pump was removed and then the spot map was a great history of achievement in John Snow's life. Cholera. His work led to the conclusion that cholera was an infectious waterborne disease, not an airborne disease. Spot map. This picture clearly illustrates everyone that This is a particular spot map which John Snow used to trace out the clusters of cholera thing. Contributions in anesthesia. In the field of anesthesia, Snow was a great expert in the field of anesthesia also beyond his works in epidemiology. Queen Victoria. He gave chloroform to Queen Victoria during birth of Prince Leopold and her daughter Beatrice. Research work, thus clinical staging of depth of anesthesia, respiratory physiology, asphyxia, and resuscitation. Anesthesia. 5 stages of narcotism or characterization as a precursor to classification by Plumley and Guidall, 1937. Dr. John Snow's death. The final day was 16th June 1858. If you all like my video, kindly give a like, share, comment and subscribe to my YouTube channel. Thank you all.